Welcome to the First Nations Health Managers Association's weekly town hall with your host, Marion Crow, your resource for COVID-19 related news and information. Send us your questions to FNHMA@ihtoday.ca. Over the next hour, you'll hear from health professionals and Indigenous community leaders. As always, we have reliable and credible information for you and your community. We want to hear from you.
Tanse from the NationTalk offices in Toronto in the lovely traditional territory of the Mississaugas of the Credit, the Wendat, the Huron, and the Chippewas. We thank you for welcoming us into your nations and your territories across Turtle Island. It is a delight to be back with you after taking a bit of a pause and regrouping. We really did not want to have to come back for this season because if we're here, that means that COVID numbers are up there. But we do want to continue to give you credible, relevant, and reliable information on COVID-19. Of course, we're going to hear about vaccination processes, and we want to encourage all of you to have confidence in those vaccines. And I'm going to steal a hashtag from Wabano Health Center, which is hashtag be great and vaccinate. I'm delighted to say that I have my first dose administered last month and looking forward to that second dose, and delighted to share with everybody that our whole FNHMA family who's eligible for a vaccine right now has made that choice to be vaccinated. Way to go, FNHMA family, for leading by demonstrating in action. So I really appreciate all of that. One more exciting thing to share with you is we had to take a bit of a break in order to accommodate a collaboration with APTN. You can catch this broadcast. I know you're listening on the internet Facebook pages and on the radio stations, but you can also have a little viewing party in your own household with folks at 5 p.m. on Saturdays to watch this on APTN. Thank you so much for partnering with us. We really appreciate that. Also, a quick shout out to Team NationTalk. We want to thank Dawn, Stella, Bellissimo Bella. Thank you so much for getting us organized. Of course, Jason Acton, Chris Alcock, and our new partners, the team at Quest Audio Visual. So we've got our introductions in terms of our FNHMA Town Hall. Let's kick it off. We've got an hour of delightful conversation. Sometimes you got to take your medicine with a little bit of tea and laughter. So we'll try to be lighthearted while we share all of the information that you need to know about COVID-19 and vaccinations. So if you have a question, don't forget, send them to FNHMA@ihtoday.ca. And you can do that now or anytime. Send that question in. So returning back to the FNHMA town halls on COVID-19, we want to welcome back with open arms Dr. Evan Adams. Thank you for being with us again to share those epi-stats and information from Indigenous Services Canada. Come on in, Dr. Adams.
Thank you so much. Watching over COVID is such hard work. It's really actually quite sad, but I am happy to see you and I am happy to talk about this because we want to help, right?
That's right, Dr. Adams.
So I was so distracted watching the numbers come in. And if you don't mind, I can tell you what's happening with Indigenous people across the country as best as we can see. Of course, there are limits to the data that we get real time, but I think we're doing pretty well at watching over our people and seeing what's going on. And so this is the first week in 12 weeks where our numbers have gone up. Since our highest point in the second week of January, that was 3 months ago, a quarter of a year ago, our numbers were at their highest peaks. And ever since the middle of January, every week our numbers have dropped and dropped and dropped. And in fact, to its lowest point, we had dropped to about 14% of where we were at in the middle of January. And that was extraordinary. And that's in part because we've done really well with our vaccinations. We've offered vaccination to about half of Indigenous people across the country. And so definitely the drop for those 11 weeks was in part related to that. This week, what we've been preparing for, what's been called the third wave in other Canadians, our fourth wave. So we've seen an uptick, and we think it's a real uptick, that it's going to stay, that we're going to see increased numbers. And that's for a few reasons. Like, we've done so well before this, guarding our communities, people getting vaccinated. We've been trying to roll it out as quickly as possible. As you know, Indigenous people were prioritized by Canada. The safety of Indigenous people was named as a priority, and that was a really great thing. But we may have some who are still unvaccinated, who may still be catching the virus. We know that there are variants of concern, which may spread more easily and may have worse outcomes. So it's hard on us. And also, Canada has been getting a lot more COVID. So there's more COVID near us. And the more that we're exposed to it, the more that we can catch it, even if we've been recently vaccinated. So there's a lot going on. However, we still continue to have a very high rate of recovery. So even if we're catching COVID a little more often than we were last week or the week before or last month, our recovery rate is about 96%, or 96% of those of us who've ever had COVID have recovered from it. And that's compared to 91% of other Canadians. So we're doing better than other Canadians as far as recoveries. The number of communities with outbreaks right now has jumped a little bit to 125. That's actually quite a lot of communities, considering that, you know, we're only several hundred Indigenous communities across the country. So 125 of us have stuff happening, including my own community. We had a small cluster just last week. And the total number of communities ever affected is 434. So the majority of our communities, villages, reserves, territories have had cases. The variants of concern, you've probably heard about the UK variant and the Brazil variant and lots of other variants that we're watching. South African variant, we now have 146 cases of variants of concern in 4 provinces, First Nations. Like, some First Nations in 4 provinces have that many cases. Vaccines are still continuing to roll out. Canada has more vaccine than ever. Every single jurisdiction and province is adjusting to the new high numbers that are arriving. Like, higher numbers of vaccine are coming in than we expected. And let me switch over to that frame, and I can give you an idea of what's happening with those. So yeah, almost 300,000 doses have gone to Indigenous peoples across the country. That's pretty extraordinary, including almost 50,000 in BC. BC's been the lead. I think they made Indigenous people a priority early on. So they were quick off the block, which is why I think they've managed to do more. Second is Ontario. Not a surprise. They have some very strong leadership. The regional chief there is there. Some of my Indigenous physician buddies have been pushing for vaccines in the cities. And there's a pretty high number of Indigenous people in Ontario. So quite a lot of Indigenous vaccine was sent there. Quebec, almost 30,000 in third place. And then Alberta with about 23,000 doses delivered. So that's the view, the very quick roughing out of things. I'm really happy to take questions. I'm sure that people are hearing things about AstraZeneca and Johnson & Johnson and thrombotic events and blood clots. And I'm sure that there are probably some of you who are hesitating, or some of your family members are still hesitating, and you want to get some clarity on that, and really happy to discuss that, because I feel bad for those who are unvaccinated and getting sick and being surprised, like, oh dear, I didn't think that this would happen. So let's keep talking.
Thank you so much, Dr. Adams. I always am so delighted to have you come as an Indigenous physician living in your nation. You really have your ear to the ground and are just an amazing leader and advocate for all of the nations across Turtle Island. So a heartfelt thank you for the work that you do. It's so appreciated. And you're right. We're going to have you stick around for the questions that are coming into the inbox. And for everyone who's watching and listening on the program, just a reminder, if you do have a question for Dr. Adams or any one of the FNHMA COVID Town Hall guests at any time, you can send those questions to FNHMA@ihtoday.ca. All right, so we also have with us a returning partner, and of course, that is the Canadian Red Cross. We have followed the Canadian Red Cross in the newspapers, in media, who are deployed all across Turtle Island, who are assisting and supporting nations who are going through some of the challenges with outbreaks, but also with vaccinations. And we're delighted at FNHMA to be a soft partner in responding to the COVID-19 pandemic with the Canadian Red Cross. So it is a delight to have that. And I know many of you across Turtle Island have formed partnerships. We are stronger together, and we can get through this together. So here from the Canadian Red Cross, we have two amazing ladies joining us, and I am going to actually start with Linda. Linda, come on in, you fellow Cree person, you.
Thank you, Marian. Wacha Kwe. My spirit name is Xkunisquel, means cloud woman, and my legal name is Linda L. Shikapio. I was born and raised in USG, which translates the land of the people. It's a traditional territory and traditional custodians of the homeland of Iuj and Inuk, situated in northern Quebec of James Bay region. I live in my community, the Cree Nation of Mistissini. Mistissini means big rock, and it is located in the southeast corner of the largest natural lake in Quebec, Mistissini Lake. It is also the second largest and the most present developed Cree community. I consider myself as a leader, speaker, advisor, and a facilitator. My background consists of community leadership and community engagement, and I am also an independent entrepreneur as a consultant, as commonly known, but I consider myself more as an advisor. I have a Bachelor of Arts in Political Science with a concentration in Public Affairs and Policy Analysis from Carleton University. I started work in December 2020 with the Canadian Red Cross as an Indigenous specialist for community engagement. Since my commitment to be part of a national Indigenous team, it has been an honor to serve for CRC, which is Canadian Red Cross, and it is definitely an empowering experience and a healing journey at the same time. I would like to take this time to honor my ancestors that have come before me, those elders who are still with us on this Mother Earth, and I await in anticipation of those elders who are yet to emerge. While humbly and gratefully recognizing those before me who paved the way, I am the next generation and committed to be part of this reconciliation process. Through putting cultural safety into action, I am glad to extend my Indigenous knowledge and perspectives by sharing tools and teachings I received by my first teachers, my parents, grandparents, elders, ancestors, and knowledge keepers. They have anchored and steered me to have a strong sense of my identity, culture, language, beliefs, and our family history. And as such, they all contribute to my sense of who I am and what I mean to others. I also want to acknowledge my colleagues for sharing their valuable expertise and our collective teamwork as Indigenous specialists. And last but not least, I want to thank my director, Sarah Burke, for believing in me, and her support has helped me press on to actively engage in the efforts of leading the development and the delivery of the briefing sessions titled Walking in Our Moccasins, Vaccine Confidence in Indigenous Communities within the organization. In terms of the background, the briefing is offered to deploying CRC team members across the country. The briefing was prepared by a solid team of Indigenous specialists within CRC, with the guidance from the management, and it is based from the perspectives and understandings of the following. During a pandemic, it is allowing us to reflect, to learn, and to do it better. An understanding of engaging multiple actions when working with Indigenous peoples. Acknowledging the past, what had changed, present, how it's impacted us, and future, our vision of approach for change. In alignment and respect to CRC's Indigenous Peoples Framework, and also to take this period as an opportunity for true action of reconciliation. We are a team of allies and driven for empowerment, focus on transforming ourselves for healing, and more importantly, in the spirit of unity. This journey of looking at ourselves collectively, we have to understand how our past and history impacts our present reality. In terms of the briefing objectives of the briefing session, it is to increase cultural awareness and understanding of distinct realities in Indigenous communities within CRC, indigenize the tools and approaches used during vaccination efforts in Indigenous communities, and also to create empowerment and promotes a focus on transforming all ourselves, and more importantly, to promote healing and the life teaching as we are in the midst of birthing something during this pandemic. This briefing session that we provide aims to use storytelling, imagery, and metaphors to increase the level of cultural awareness of deploying CRC team members and supporting functions who will be supporting vaccination efforts in Indigenous communities. The briefing session is offered by the Indigenous specialists through virtual. We often use the Zoom, and the language of briefing is delivered in English, and it is recorded for future learning purposes within the organization. Learning experience, we always start off by informing the participants of the importance of proceeding with an opening prayer before engaging in any activity, for grounding the learning experience in respect, harmony, balance, and peace. And we also bring in the TP teachings, which is a metaphor used when entering the space with the right state of mind for a truly respectful collaboration with Indigenous communities. We also bring in the medicine wheel. It's an understanding the full circle of Indigenous health from past to present and to future. Birthing and renewal is really about establishing a community-centered approach based on the guiding principles of CRC's Indigenous Peoples Framework. The tools for increased collaboration, building from our shared knowledge and tools. So in the end, we end with a sharing circle, allowing for meaningful engagement and discussions and sharing of experiences and insights. Our typical sample agenda would include an introduction, a cultural safety and cultural humility, and a glimpse of life in a remote community, and a brief overview of our shared history and current challenges, and the impacts of our work, the medicine wheel, and from vaccine hesitancy to vaccine confidence, and the TP teachings as a metaphor for entering community. And we informed the participants as well for other tools, which are like 72-hour preparation before going into the community, We also provide community profiles, an inclusion checklist. We developed a service pledge by our team and a learning module on CRC's Indigenous peoples and reconciliation. And as I mentioned, we provide a sharing circle, which is for questions and answers. In terms of creativity, we ensure that the provision of culturally safe, we also incorporate creativity by using other available Indigenous-based sources. For example, one of our briefing sessions, we encourage the participants to watch a video on sharing medicine, First Nations, Inuit, and Métis perspectives and knowledge sharing on COVID-19 vaccines. And this one is specifically on COVID-19 vaccine hesitancy. The video provided a great dialogue and insights from a Mohawk mother from Ganawagi. I'm going to try to pronounce it. Kahintinta Horn and her two daughters, Dr. Ogisto Horn and Wanique Horn-Miller and Leonard Benoit. My colleagues are always open and receptive in enhancing the briefing session, but more importantly, to respect, modify, and customize the briefing session accordingly for each province. We have delivered a couple of briefing sessions within the organization, and we have received positive feedback from many participants, especially the leads, managers of the organization, are recognizing and appreciating the value of this learning path experience. From this, it makes it clear that we continue to take on the demands of the briefing session. Walking in our moccasins, vaccine confidence in Indigenous communities continually makes progress to grow with the organization. In closing, as an Indigenous woman who has found a sense of peace, I believe in moving forward, and healing begins in an environment of safety and trust. By developing safety and trusting relationships can be accomplished through cultural competency training. Our neighbors in this country need to know who we are as Indigenous peoples and to make space for us to share our knowledge, practices, and tools so they too can learn about us. At the heart of humility is a desire to serve and a dedication to helping others become great through the engagement of peaceful relationships, because they speak to our resiliency as a people. This is reconciliation in action within Canadian Red Cross. Miigwech. Back to you, Marianne.
Thank you so much, Linda. I really appreciated learning about the reconciliation journey that you and your team are on at the Canadian Red Cross. And to continue that dialogue, let's welcome in your colleague, Kellyanne. Welcome back to the FNHMA COVID-19 Town Hall. Come on in.
Thank you. What's going on? Dano Sego Zewoguego, Degardi Wanhawi Jets. Welcome and hello, everyone. I am Kellyanne Malash, and my name is Degardi Wanhawi, which means she comes with a message. I always wonder if my grandmother was able to foresee her or if she cursed me. One or the other. I'm coming to you with a message. As my name entails. So response and preparedness with the Canadian Red Cross National Office. I do have an emergency management background of 29 years working in communities and with brother and sister communities across Turtle Island. Thank you for inviting me into each of your communities, as well as working in partnership with the Canadian Red Cross. The more partners we have, the better prepared we are. And just knowing the resources that are out there is that much better. So what have we been doing in the last 13 months with the Indigenous Peoples Help Desk? We're learning a lot with each other. So I always say that it's knowledge transfer. So when we come into community, we get to learn about your community, your geography, your resources, from human resources to material to infrastructure. And then with the knowledge of emergency management, we then help you to develop your response plan and preparedness plan for COVID-19 pandemic. Every community is at a different stage in terms of response, but also in terms of emergency management. So our Indigenous Peoples Help Desk will help guide you through those steps. And that's exactly what we've done for the last 13 months, is look at the what type of readiness are you and your community at? If you've got your roles already, if you've got your committee already, or is it just an elected official or council chief that's taking the lead in this response, then we'll guide you step by step in noting what are those roles and responsibilities, and perhaps what are some other partners that you can use in order to respond. So from different steps in terms of your resources, whether your sister communities are 100 kilometers away or just 10 kilometers away, this is the time to try to work together. Hence that kind of opening remark in terms of the more partners that you have, the better prepared we are. That really is the case in this respect, because we do need to help each other. And we are certainly, and we can be a partner with your preparedness and with your readiness, and of course, with your response. I did notice that the pandemic has hit our communities in various ways, not only in terms of physical health and mental health, but also in terms of spiritual health. The struggles that we've had in terms of going back to ceremony and getting back together for ceremony has been tough. But you know what? That when we're offering tobacco, or when we're giving our prayers or saying our thanks and appreciation, it's heard no matter where you are and no matter who you're with. Yes, it's better together. But at this point, within the pandemic and within our fight against this unseen enemy that we have before us, at this can give those prayers and thanks and appreciation apart for now, and they know that our appreciation is there. So I want to thank you for that, and let's keep working together. Let's keep our partnerships going through these virtual, avenues that we can. And even don't forget, there's still the phone, so we can still call each other and still talk to each other. Thanks so much, and back to you, Marian.
Kellyanne, thank you so much for that. It's so appreciated where we can partner in the middle of a pandemic and actually get some collaborative work done. And on that note of collaboration, Canadian Red Cross has been a wonderful partner to individual nations and to us as an organization. We also have developed some pandemic planning tools for your nation at the First Nations Health Managers Association. So I think we're uncovering and unpacking that there are a number of supports, tools, and resources for your individual nation. So please reach out. Canadian Red Cross, FNHMA, we're working shoulder to shoulder, and it is such a wonderful opportunity to strengthen the support that we are providing to nations across Turtle Island. And with that, as another resource for you and for your nation on COVID-19, I'd like to share with you a public service announcement from the First Nations Health Managers Association. So Anthony, to you in the studio for our public service announcement, please. Created by your First Nations Health Managers Association, we introduce InfoPoint, a convenient and accessible helpful desk for First Nations health managers looking for credible sources of information on COVID-19. Don't have time to dig? Talk to a real person now at 1-855-446-2719 or email infopoint@fnhma.ca. Indigenous Health Today is another resource of information by region at ihtoday.ca. Well, thank you so much to our partners at Quest Audiovisual in the studio playing our technology for us. It sure is appreciated. And I have to say, I love the graphics that Jason Acton has come up with, another Indigenous partner in giving this information to you that's credible, relevant, and reliable. Speaking of more information, if you have a question, it's not too late. Send those questions to FNHMA at ihtoday.ca. So the inbox is heated up, and I think what I'm going to do is, Dr. Adams, I'm going to put you on standby for a moment, and actually I'm going to come back to you, Kellyanne, if you don't mind, because I'm wondering, in all of the work that you have been doing with the Canadian Red Cross, what are some of those challenges that your team has seen in the past year occurring on the ground in our nation? So Kellyanne, for you to take that question.
Thank you for asking, Marian. And honestly, what ends up happening, or what I've seen as a challenge for our communities, is when there's a known case in the community. Like all of a sudden, they know that COVID is there and there's a known case. What I've seen is that community officials will make sure that everyone is all hands on deck. They want everybody to get to work, everyone report, we all need to do this right away, to tackle this and get it under control. But that's not the way to go, because remember, this is not a sprint. It is a marathon, as you know now. And what we need to do is kind of start at that half staff. And then your other staff can be on standby. You can go on staggered shifts, whatever that might be, whether it's the council employees or town employees, whether that's your clinic or your health staff, if you've got a nurse in charge in the community, whoever that may be that is working to help, whether it's your checkpoint personnel or new hires that you've gotten in the community. You want to make sure that you stagger those shifts so we don't burn everybody out all at the same time. It really is important because it is long term. We don't see the end of this yet. We're still, we kind of prepare for the worst, hope for the best. And that's what I want you to do, and make sure that you keep your staff healthy by doing those staggered shifts.
Oh, thank you so much for sharing your experiences in the past year with some of those challenges. Kellyanne, one more quick question for you. Then I'm going to go over to Linda, and then Dr. Adams. We have a lot to get down to. Kellyanne, there's a question in here that you and I had an opportunity to discuss just before we came on air. One of those questions, and I know you can speak to this from your personal experience, but there is somebody who's typed in a question just informing us that this person has had 2 recent blood and iron transfusion and is currently waiting for surgery that was recently canceled. I mean, we know that our hospital system, especially in Ontario, is over capacity right now. I know the Ottawa Hospital is taking patients from Toronto, where our largest hotspot is. But with all that and surgeries being canceled, now this person is wondering if the blood and iron that they received would have been verified that the donor was COVID-free. What are your thoughts, Kellyanne?
That's such a good question, and definitely something to talk to your healthcare provider about and your surgeon, that really have those candid conversations with them. From a personal experience, because I do donate blood, and when I go there to donate blood, and in HEMA Quebec, out in Quebec, that is the one that works there, or that takes the blood, they told me, the nurses told me there, that they will check for the antibodies and for the virus within your blood. And if it's found, they'll call me, that it's been found, and they either discard the blood, they do not use it, or they will use it for testing and science purposes. So they would have to call me to ask me permission for the testing and science purposes, because when you go to donate blood, it's for life. So if it's not for testing and science purposes, that's why they would call me. So they would either discard it or use it for testing purposes.
Well, thank you so much for sharing that, and thank you for giving the gift of life. Blood. Thank you. Much appreciated. Linda, you referred to the resort walking in our moccasins. Is that something our viewers and listeners can find online at the Canadian Red Cross website?
Actually, we developed this briefing session for the deployed staff for within CRC. So it's not available online, but it's more geared for the staff to prepare them to go into the Indigenous communities.
Well, thank you for just following up on that. Obviously, people are very keen to get access to resources. So thank you for answering that. And thank you for the question from the inbox. All right, Dr. Adams, are you ready? Come back on in. Just a couple of questions for you, Dr. Adams. With the new variants, and we know that is what people are concerned about right now, especially with vaccine confidence happening. People are becoming vaccinated. With the new variants happening, is Public Health or Indigenous Services Canada tracking reinfections that you're aware of, Dr. Adams?
Yes, absolutely. We are tracking reinfections. Reinfections are still fairly uncommon. We don't have that many cases where someone's had a second case, a different strain. Because people can have had COVID and then be vaccinated, they're building up some pretty good vaccine coverage. And probably people are wondering, are the new strains going to be covered by the current vaccines? Remember, there are 4 vaccines that have been allowed in Canada. Really, only 3 of them are available. The 4th, Johnson & Johnson, isn't available yet. And so we're watching to see how the current vaccines cover the most predominant variants of concern, which are the UK variant, the Brazil variant, South African variant. And it seems the UK variant is well covered, generally well covered by the current vaccines. We're taking a closer look at South Africa and Brazil, and maybe the news there isn't so rosy. But this isn't uncommon with vaccinations. Like you probably remember with the flu vaccines, there are lots of variants that need to be covered. And we have new vaccines every year that cover different strains. And so there is, vaccine technology that's trying to keep up. So there is a reason to be hopeful. I know for some people are saying, all the new variants, when will this ever end? But we do have some technologies. And each of the different vaccines have a different way, a different mechanism of trying to protect you. So having a few different kinds of vaccines also might be helpful with the variants. So there's a lot of reason for hope. I just don't want people to feel despondent and like this is taking over. And remember, the variants of concern, just by its very nature, if something is stronger than if one say animal like a raven is stronger than a crow, if you put them together, the raven will predominate. They won't coexist. That's just the nature of biology. So we do expect stronger strains, variants of concern to eventually predominate. So we don't want people to be scared when variants appear near them, but you should be careful. We're asking people, who've been exposed to variants of concern or have a confirmed variant of concern, that they take precaution extra precaution. In some places, we're telling people to, they have a double duty now to stay home and protect others.
Dr. Adams, stick with me. Another question for you is, once you have been vaccinated, and again, be great, vaccinate. Thanks, Wabano, for giving us that hashtag. How long can we expect that immunity to last? And will we need to have a regular booster shot in the future like we do with the flu? Have we unpacked that science yet? And I'm just going to remind you, Dr. Adams, to unmute, and that's $20 in the kitty for VIO volunteers.
Still owe me $20 from that bingo game last. God, it wasn't even last summer, was it? It must have
Checks
been
in the mail.
Sorry about that. I mean, how often do we not go off mute every single day? So the question again was about.
So the question is how long do we think that immunity is going to last once we've become vaccinated? And is there a requirement, or do we know the science about having to get a booster or an annual vaccine every year with the COVID vaccines?
Yeah, we have some theories about it, but we have some real world data. The vaccine hasn't been around very long, so we can't really observe it. But we do know that the vaccination response lasts at least 6 months, and that's how long the vaccines have been available, right? So we know that people who were vaccinated at the very first possibility still have antibodies. So we may need boosters frequently because we are starting to see these new variants. So it wouldn't surprise me if we had to go for yearly boosters. But for some vaccines, like the chickenpox vaccine, the booster happens like 40 years after the first one. And that's really quite extraordinary. Your body has memory to fight off certain things. It can last for a long time. Your body memory can last for a long time. So we'll see. And I am honestly, and I have to say this, for me, getting a shot is such a small thing compared to the so many different kinds of things that could happen to you. I mean, even smoking a cigarette is harder on your body, I think, than getting a vaccination. So, or going for a run, which is healthy for you, but hard on your muscles. Your muscles have to actually kind of rebuild after a good run. I don't know why people are so nervous about it. So I've asked a few people. Some have said they're scared. Some have said, oh, it's just like being scared of rats or spiders. It just happens, and you have no idea why one person is scared and another person isn't scared. But anyway, I do encourage all of you not to be afraid of a little prick.
Well, we won't be afraid. And if you are, we'll send an auntie to tune you up. How about that? Because we know our aunties in the nations will just say, go get your shot.
Come on.
You know what? That's why I love doing this work, is because we get to share so much information that's reliable, credible, and comes from community health professionals and leaders with a little bit of laughter, right, folks? And for the record, a raven is not stronger than a crow. Badooch. I had to say it. All right. Dr. Adams, in terms of the tracking, are we over 600 nations that have now undertaken a vaccine process? What does that look like? Around 600-ish?
Oh, that's right. Yes, I'm sorry, I didn't report on that. Yes, I know last week when I was looking at the numbers, we were very close to 600. We must be over 600 nations that have started the vaccination process. Absolutely. So that's amazing. And also for many of our jurisdictions, they've started vaccinations for off-reserve members or our urban cousins. So really big efforts in that regard in a number of places, and that's most welcome. Unfortunately, we we still, I think, need to include more of our Métis cousins in those efforts. And I hate to bring it up because it's kind of sad, and sometimes people get mad at me. It's like, yeah, why aren't you doing more? And I guess I can wear it and say, yeah, I absolutely, I need to, and so do you, include our Métis cousins in these efforts. It's really important.
I really appreciate that comment, Dr. Adams. I think it was our last show where I shamefully called out the province of Manitoba because they weren't including our Métis cousins in the vaccine efforts. And there I go again, province of Manitoba. Okay, so now we've spilt the tea.
And there are a few, and it, you know, we all have these historical legacies. Like, we've inherited this world that we now live in, and yeah, the Métis have not been given the same access to a lot of resources as First Nations and Inuit. So let's work on that. Put it on the list.
Heard. And I know Jocelyn Forsma at the National Association of Friendship Centers, I'm calling you out, girl, for an amazing job at advocating for all of our urban populations as well at the COVID vaccine working group table. So thank you so much for looking after all of us urban folks as well. We appreciate that. Dr. Adams, you're just in the hot seat today, but I hope it's a fun one. We do have another question about variants, of course, and the question is, with the multiple variants that are being reported, the UK, the South African, when we get vaccinated, does this help us from getting more sick or sick from those variants too? What does that look like?
Yes, and that's actually the main issue that we're looking for in vaccine coverage. As in, if any vaccine should be able to prevent serious illness. Like, if you get vaccinated and then you get COVID and it's just mild illness, that's not very interesting to me. What's more interesting, or what I'm really looking for, is if you're vaccinated and then you get seriously ill from, say, a variant, then that needs to be noted so that we can make changes. If you get vaccinated and you get a mild illness, then actually the vaccine is doing its job. It's probably saved you from more severe outcomes. So yeah, so like I said earlier, there seems to be some crossover. There's some prevention of serious illness with the variants from the current vaccines that are available.
Thank you for that. And another one we're so fortunate to have you with us, Dr. Adams, because everyone wants to ask a doctor, a healthcare provider, a nurse, a public servant, somebody who has expertise on these subjects and who is Indigenous as well. It's just that trusted source of information. So thank you, Dr. Adams, for being with us again and for taking all of these questions. Now that people are starting to achieve getting immunizations for all of our nation members, when do we start seeing children becoming vaccinated? And will that look like a needle? Is there a different strategy for children? Is there some sort of science you can share about children vaccinations with us at this time?
Yes, I know that Pfizer and Moderna have started to include children 12 and older in their trials. They're giving vaccine to child volunteers to see how they do. And I think the data is very close to being presented to us so that we can see if it's effective and, most importantly, safe to give Pfizer and Moderna to children 12 and older. So ask again very soon what will happen in that regard. But I haven't heard of younger than 12 being in clinical trials yet. It's possible, and I haven't heard about it because I'm looking more towards tomorrow than next month, just because that's the nature of the work at the moment. But that's a good question. That's a very good question. I should ask around and see if anyone knows what's
All right,
happening.
we will bring that back in maybe a month or so. Just so the viewers and listeners know, we're committed to bringing you 12 hours of this kind of talk over the next 12 weeks. So we will come back to that question. This is the first of the 12 hours. So we're going to be sticking around right until summer break. And hopefully we don't have to come back in September. After 12 hours of this, you'll have had enough. So.
And if I could add, sorry to interrupt,
No, come on in.
that children usually have much more frequently a mild illness with few complications. Hospitalizations amongst children is very, very low, which is why we haven't been prioritizing them, which is why they're at the back of the line. It's much like the older you are, the more likely you are, amongst other factors, not just age. The worse your outcomes. So yeah, very rare to see children badly affected by COVID. So I just don't want people to be scared and worried. However, children can transmit, and also we're worried. I'll just throw it out there. We're worried about how young people, once the vaccine's available to them, if they'll consent to the vaccine or not. Like, are young people more cavalier? Too cool for school to get the vaccine? We're worried that they're not getting it.
Thank you for making that point. And, for all of, I know we're tracking some of the demographics for COVID infections, especially right now. And I'm going to refer to Ontario because that's what I know. And we're seeing the infection rates go up in younger people. So I'm talking about that under 40 group. And if you haven't yet seen Matthew Cardinal in Regina, this is a 30-some-year-old man who is pleading with the public. He actually survived COVID, but was put on a ventilator. We're going to try to get him as a guest on this town hall. And on that note, if you have a suggestion for a future town hall guest, a topic, all under the umbrella of COVID-19, of course, send us a note. We want to hear from you. What do you want to know about? We'll track the people down and we'll get them to share their inherent knowledge about COVID-19 and what they know from medical and clinical expertise. And again, you can send those suggestions to FNHMA at ihtoday.ca. Dr. Adams, I'm sorry, Kellyanne and Linda. Dr. Adams is like hot commodity today. Evan, in terms of when people do get vaccinated, what does that look like for gathering? Can vaccinated people gather together? What's the verdict on that? And we have a couple of minutes to go over this question, but like, are we still wearing masks? Are we still, using our hand sanitizer, staying away? Or can we have somebody over who's been vaccinated if I've been vaccinated too? What does that look like?
Oh dear.
I know.
This is a really important question because we're seeing what's called breakthrough infections more than we thought we would. It was kind of surprising that people are getting sick 1, 2, 3, 4, even longer than 4 weeks after their vaccination. So what does that mean? And it's not just because people are changing their behavior. Oh, I've had one vaccine out of 2. I have some protection, so I'm gonna, go and, go to a party or something like that. And then they're not safe. They're not socially distancing. They've stopped wearing their mask, and then they get sick, and it's very troubling. It's also possible that for some of us biologically, we don't mount as much of a response as we would like, for instance, older people. And so for them, it's also important for them to keep up their public health measures. And we haven't decided yet who can do what. Now, remember, just because you're vaccinated doesn't mean we have herd immunity, because in Canada, there's still quite a lot of COVID. So maybe you got your vaccination last week, but just down the street, there can be, quite a significant exposure, quite a heavy dose of COVID infection. And that's something that we still need to avoid. So people still need to stick to what we were doing before. The second dose will give you even better protection, so that's important for us to wait for. And then also, like, who else around us is vaccinated and for how long? So I think so. Anyway, I hope that people have heard me. Breakthrough infection is a real thing that we need to be concerned about. Thanks.
Thank you, Dr. Adams. And just a final quick comment from you, Dr. Adams. Sorry, Kellyanne and Linda, for not coming back to you. This hour has flew by like that. Dr. Adams, in like 15 seconds or less, why should we trust the vaccines?
Gosh, I've heard people say that they got their vaccine and they were waiting to die. Like they really thought that the vaccine was going to do something bad to them. And as I've said so many times, we're trying to do something good, not bad. We're trying to help you, not hurt you. So definitely people need to kind of keep that in mind. And also our teachings are, to receive medicine with a good heart, not with suspicion, not with fear, not with skepticism, but that, you're doing this and, you're doing this for the right reason, and you're not just doing it for you, you're doing it for us, for protection of your family and communities.
Thank you so much, Dr. Adams, for taking a stab at that. Kellyanne, Linda, thank you so much for having the bravery to come back. We appreciate it. And for all our viewers and listeners right now, I just want to remind you, if you're watching this online, you can catch us again this Saturday at 5 p.m. Eastern. And be sure to check out us next week on ihtoday.ca every Wednesdays at 1. Now, thank you to Micmac Maliseet Native News, the Wolf 95.7 Nation News, FNHMA, of course, Element FM in Toronto and Ottawa, and Nishnawbek News, Wayte News. Did I say that right? I apologize if I didn't. We also want to say thanks to NCIFM, APTN, way to go. Thank you for having us on your station. Eagle Feather News, Alberta Native News, CJWE, CKLB, Co-op Radio in Vancouver, First Nation News, CFNR in Terrence, BC, and of course the Port Albany, BC newspaper. And with that, until next week, hi.